Welcome to another episode of Medicare Industry Insider. I'm Jalen Jackson.
And I'm Rachel Bremeyer.
And today we want to talk a little bit about the kind of forgotten caregivers in America and around the world, but particularly here in the U.S. as it relates to our Medicare beneficiaries and the people that we work with every day, and how you as an insurance agent or agency owner or administrative staff, whatever your role is in the process of helping people find and receive care, how you can make an impact. And wanted to start with a quote from actually Rosalind Carter, former First Lady of the United States, who recently passed away last winter. And Rosalind started the Center for Caregivers in the U.S. and made mention at one point in time, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And we thought that was a really great way to kind of kick off this episode that is hopefully going to shed light on a huge issue that many of your clients face.
I think that quote hits the nail on the head about everyone being a caregiver at some point in their life or knowing a caregiver at some point in their life. In fact, 53 million people in the United States right now are caregivers, and that has increased by 9.5 million between 2015 and 2020, which is just mind-blowing about how many people are actually caregivers. They even, this is all from, some of it is from AARP.org. There's some from A Place for Mom, which is actually a really, really good resource for anyone looking for things for caregivers, is A Place for Mom. But there's so many resources out there, like AARP has tons, the Rosalind Carter org, lots of stuff out there for caregivers. We'll go into all of that. But just in general, a lot of people are caregivers, 53 million.
Absolutely. And I guess we should specify when we're talking about caregivers, we're specifically talking about those caring for loved ones or people maybe not related to them that have some kind of medical or custodial need. Not so much parents and children in most cases.
Good point, yeah.
But, caring for another adult that has some kind of medical or custodial need where they can't take care of themselves.
Both of us being parents, sometimes that's also how we think.
It is, yes. Yeah. Caregivers all the way around. Part of that sandwich generation.
And actually, that actually fits right in there is a lot of the caregivers, when you look at an average caregiver age, you're looking at someone usually in that sandwich generation that's, between usually 50s or 60s, caring for their kids. That's why it's sandwich, caring for their kids and for their parents. So they're stuck in the middle, taking care of both sides. So Absolutely. It is an interesting thing to look at, most of them being female too. So it's changed a little bit, but we'll go into statistics on that.
Yeah, absolutely. And I think one of the biggest things to make note of is the length of time that people are caregivers. Super common for people to need care for 5+ years, increased from 24% in 2015 to 28% of people in 2020 needing care for in excess of 5 years. Obviously, that has a lot to do with, a lot of life-extending technologies, whether that's better medical treatment, better access to care, various things like that. It's also in part due to the rising costs of facility or home-based care. One of the biggest reasons that people have a family or community-based caregiver is because of lack of access or affordability of something like nursing care.
Yeah. And in fact, this was very shocking. Family caregivers who live with senior relatives can spend an average of 37.4 hours a week, so almost a full-time job, taking care of that person on top of doing whatever else they're doing. And I mentioned most of them being female, but there are 24% of them are men, specifically unpaid caregivers, which that's the other thing we're talking about is mostly unpaid, not like a home health aide or anything like that.
Correct.
These are people who are taking their own time, their own money, a lot of times taking care of someone.
Yeah, absolutely. And that percentage of unpaid care being provided by male caregivers has actually more than doubled just since 1995. So in less than 30 years, we've seen a lot of men, fathers, brothers, nephews, cousins, sisters, well, not sisters, but a lot of men stepping up to provide care for their family members. And in most cases, almost half, 48% of people are caring for a parent. That's the most common relationship between the person receiving and the person providing care. But there are a lot of people also caring for their partner. And again, with a huge chunk of care being provided by women, a lot of wives caring for husbands, wives caring for their other partners, and a lot of care being received by friends, neighbors, other non-relatives. Mm-hmm. So if you've ever gone and checked in on that, the little old lady that lives down the street, or brought soup to the guy that tells the kids to get off his lawn, you are a part of the nation of caregivers that we have become.
Yes. And in fact, there are 10 main reasons seniors need family care. Family care meaning just any sort of care, actually. When we looked at that, 16% are old age, or basically they're just needing it because they're older. 16%.
Mom just can't get around like she used to, mm-hmm. needs a little bit of help.
Yep. So that's the number one reason people need care. Number 2 is going to be mobility assistance. Number 3 is Alzheimer's disease at 11%. And then you go down to a lot of like care, like cancer, post-surgery or wound care, stroke, diabetes, fall, blindness. The other one that is in there that a lot of people don't think about is mental illness or emotional inability to care for themselves. That's 5%. Mm-hmm. But those all fall into the top 10 reasons people need care.
Absolutely. And I think one of the biggest things people should recognize about a lot of these, well, things like Alzheimer's, dementia, cancer care, post-surgery, a lot of these are kind of what I would call unavoidable means of needing care. You know, it's a specific situation or illness that requires that person to have additional supervision. A lot of things like mobility assistance, old age, or just general infirmity, they're not temporary, but mm-hmm. they're also care that is primarily, I wouldn't say primarily, but money is always an aspect. Mm-hmm. The inability to be able to pay for home modifications or other safety features that might allow someone to age in place, or on their own longer, can be cost prohibitive to a lot of people. So these family caregivers or other caregivers step in more and more often as we see things like that become more and more expensive.
Yeah, we actually looked at the financial strain, and AARP did a really good study in 2001 and figured out that family caregivers spend an average of $7,242 annually, or approximately 26% of their income, providing care to seniors or loved ones. And then this was really sad also, but 22% of caregivers reported using all their short-term savings. 12% said that they went through all their long-term savings while caring for an elderly parent at home. So you're completely right, Jalen, is, it's not only like the strain that we've been looking at, but like financially doing modifications for homes, feeding them, maybe taking them to the doctor, that's gas bills, that's time, maybe they're taking off work.
Well, and the thing that I want to make specific note of is you look at what those numbers mean. $7,242 annually, or 26% of their income. That means due to the time and financial and emotional and physical burden of taking care of their family member, that means the average caregiver's annual income is less than $30,000 a year.
Mm-hmm. Sad.
That's a significant financial hit to someone who, again, same generation, likely has a family of their own to take care of. And the long-term impact of this financial strain is a generational recurrence of this exact same caregiving need. Mm-hmm. When you clear out your long-term savings to care for a parent when you're in your 40s, 50s, maybe even your 60s, it means that far too soon your own children may be facing the exact same situation. So it's kind of a self-perpetuating cycle in many cases.
The other thing that we wanted to mention was just the stress it causes caregivers, because the biggest thing we've just talked about, they're not making enough money. Mm-hmm. They are also taking away from their own job. A lot of them are women, maybe unpaid. Mm-hmm. Because they're taking so many hours, we even said, 37 hours?
Yep.
They are not taking care of themselves. So what you find is a lot of caregivers also have a lot of stress in their life, and they suffer from depression and psychological distress. A lot of them are also being diagnosed with 2 or more chronic conditions, 53%. And this is the scary thing. 14% higher than the general U.S. population, according to the CDC. So that means a lot of the caregivers we're running into not only are not taking care of themselves, but are also being diagnosed at a higher and faster rate with chronic conditions than the general population.
Absolutely. And it's particularly dangerous in that 11% of caregivers that are caring for a spouse or long-term partner, when they are likely close to the same age. So you've got two aging people trying to take care of each other. And it can further stress that already potentially medically fragile individual and result in worse health outcomes for both individuals. So it is a lot of emotional and mental stress, but it's just physical stress too. You know, the physical ability to help someone get in and out of bed, dress them, bathe them, clothe them, eat them, help them eat.
Don't eat them, please.
Yeah, please don't do that. But help them eat. You know, things like that are physically demanding as well. So it can cause a lot of physical demand on some of those caregivers as well.
100%. I can't imagine. I have a 2-year-old and I took care of her when she was, 7 pounds, doing all of the things that a caregiver does with a full-grown human with that weight, getting them in the bath and changing them and putting clothes on. And I can't imagine. So there's a lot of stress, a lot of physical, emotional stress that caregivers go through. Unfortunately, the only relief these caregivers will really get, unless you've paid for some sort of home health aid, if they're available, which unfortunately in a lot of rural areas they're not available, and they're very expensive on top of that, because home health care insurance pays for a professional to come out, but not home health aid, which would help with bathing and dressing and helping them eat, things like that, is respite care. So respite care is important, but unfortunately and just so that you're aware, it's available for people, but it's only available for people whose loved one is in hospice care, and it gives that person, the caregiver, 5 days break. It is covered by Medicare, but that's the unfortunate thing, is that they have to be in hospice.
Yeah, and again, eligibility doesn't mean accessibility. Mm-hmm. So even if someone's eligible for that respite care, there still has to be availability in hospital or skilled nursing facilities to care for that family member while you take that well-deserved respite.
And actually, I'll bring up a personal story too, because my grandpa, initially when he was going to go home, they were wanting to get him out of the hospital. Obviously, it's a business. They're trying to open up beds. And their initial thought was he needs home health care. He needs not only a home health care nurse to come out, but home health aide, because my grandma was also in her late 80s and there was no way she could lift and move and do things for him. We couldn't get him home because where he lived was a rural area, and there was absolutely no home health care aide. There was no home health nurse available, and there was no way to send him home. So that's another thing to think about is, where does this person live and what availability do they have? Because it ended up falling all on my parents because they live nearby. We're near hospitals, and that was the best route, was to have my parents get him up and down and shower and bathe and do things like that, because he couldn't go home. There was no option.
Yeah.
So I think you're completely right on just accessibility for help for people who are caregivers.
Oh, absolutely. Accessibility, and until very recently, oftentimes, I hate to say stumbling around in the dark, but that's kind of how a lot of caregivers have had to go about their role. And it hurts them, and it hurts the people they're caring for to not be properly trained or properly educated on how to help their loved one through this diagnosis or issue, or just the challenges of aging in place. Mm-hmm. And luckily, as of November 2023, thanks to some new legislation and changes to physician fee schedules, the doctors actually will now be able to be compensated, meaning they're more likely to do so, for training caregivers. So they can now be trained. Caregivers can now receive training from their caregivee, the person they're taking care of, from the physician to help learn how to help manage any medical needs, help learn how to get that additional training for daily activities like bathing and feeding, learning techniques for transferring, and things like that. And because doctors can now get compensated for that, it is expected that that will be an activity that increases drastically as long as doctors know about it. And I think that's where, as you know, I don't want you to think we're just spitting information at you. As an agent, there are some clear action items that I want you to walk away from this with. One is to work with your centers of influence that are physicians to help them understand what this means and how they can better utilize this. Two is to connect better with your clients and make sure you are recognizing, identifying, and connecting with those caregivers in their lives or future caregivers, if they're not there yet, to make sure that they know this is a service that's available. Specifically on this one, but really for a lot of the things we're about to talk to as well. Another great note from the kind of press release regarding this new benefit that's available, the doctors can actually get compensated for. Right now, it's estimated that on an annual basis, unpaid caregivers provide an estimate of $600 billion in unpaid care. And again, right now, that is largely without appropriate training and education, but hopefully we can see that change in the near future.
So going along with what you had said, Sheila, of like, as an agent, there's some specific action items.
Absolutely.
Since we're talking about caregivers, there's a couple things that you as an insurance agent can help at least educate and help the caregiver know what they need to do so that they can better care for their caregivee, whatever, the person that they're taking care of.
There's some poorly defined terminology, so bear with us, please.
One of the big things being that just having a medical power of attorney does not allow that person to make insurance decisions. There's a couple steps that person can do. A medical power of attorney is excellent and very much needed because it allows them to help make medical decisions if they ended up needing anything in the hospital or to a doctor, things like that. But in terms of calling and being authorized representative when you're talking to Medicare and to the insurance carriers, there's additional forms that they need to fill out. So there is one form. It's a Medicare authorized representative form, and it's authorized to disclose personal health information. So there is a specific form that CMS requires to allow you to have someone else speak on behalf of you and to take care of anything if you needed someone else to call on behalf of you. So that form is needed. In addition, every single insurance carrier also has their own forms. So you also need to reach out to each individual carrier and make sure that that form is also filled out. So if you know someone has a medical power of attorney and is signing on behalf of this client, it's very, very important as an agent to pull both those forms for them.
Absolutely. And also, we'll backtrack a little bit to networking, because I think one of the biggest things you as an agent can do is have a robust network of resources for caregivers. Because if you're lucky, you can proactively find out who these people are, help them set things up ahead of time. But unfortunately, most often you're going to run into people who are stressed and overwhelmed and even becoming physically unable to do the work because of the burden that caregiving puts on them, and you're going to be playing a little catch up. So having a robust network of family counselors, attorneys well-versed in elder law and POA, sources of financial assistance in the community, even things like rental real estate property management services. Mom and dad are moving in with us so we can take care of them, but we don't want their house to just sit. Let's put it on the market for rental or sale or whatever the case may be. Or even if it's a temporary situation, having things like lawn care, pet services, finding out who can help out with Meals on Wheels, or, going to your voluntary action center or area agency on aging for resources.
Mm-hmm. Yeah, there's so many different directions you can go. And I'm seeing more and more, both of us have kind of been put in situations where we've had to help or assist caregivers. And it's just so important to be a resource in your community. Even knowing people at the Social Security office, doctors, including physical therapists, would be very important, because a lot of people needing any sort of caregiving are usually getting out of surgery. Not usually. That is a portion of the top 10 that we talked about. Pharmacy reps, accountants, or financial advisors. Those are important because if you are referral partners back and forth, Maybe that person then knows that they need to also put these extra forms like the authorization to disclose personal health information in the documents as well, with those power of attorney documents. Dentist, hairstylist, that's actually one that you and I were talking about, of just making sure that if that person can't leave the home, or if it's like very, very difficult, would someone come to their house? Or just making sure that if they got relocated, a lot of those people have had the same hairstylist for years and years and years, needing a recommendation for a new person if they are relocating. Another one going along with hair is manicures and pedicures, because a lot of people can't do their own nails, whether it's like their toenails, they can't reach it anymore, or just feeling a little normal, which would be the manicure side, maybe getting a little polish on their nails. So finding people who do take care of those elderly people who need it, or would come to their house or come to the assisted living, things like that would be really good networking partners to have.
Absolutely. Absolutely. And I think the biggest, again, the huge takeaway is to have these resources on hand. And when we talk about networking and building partnerships with these folks, it doesn't just mean having some business cards on your desk or in a file folder somewhere. It means creating real relationships with these people. Obviously, find folks you can trust, and it's not a checklist where you need to have every single person on this list before you can do something, but find ways to promote your services together. Again, to the extent that you're comfortable and is compliant for everyone involved, but find ways to create, folders that you can all have at your offices and hand out to clients as needed. Back when I was an agent, I had friends in several different industries, and we targeted a lot of the same demographics. And I remember standing around my buddy's pool table with, big manila envelopes and just stuffing flyers in there for hours at a time. One of us had a postage account, and we all brought our own flyers and split the postage. And instead of being able to mail our flyers out to a few hundred people each, we sent them out to 10,000 folks in the Columbia area. So use that power to multiply the impact of your marketing, whether it's, old school stuffing envelopes or digital or whatever the case may be, but having those valued connections, people you trust to, find someone you would trust to handle your parents or your loved ones, information and issues, and partner with them in ways that make sense.
Mm-hmm. I think that goes back to just making sure that you're a huge pinnacle in the community, that people know who you are. And we made a very long, rough list of different networking partners that you could work with, and just thinking through things like home health care agencies, skilled nursing facilities, adult daycare, moving companies. Holy cow, there was a ton of things that we were talking through, but we were like, okay, if this person no longer lives at home, if they can't get access to home health care, if they, like hair and nails, there's so many things that we were thinking through. So it's a really good exercise to sit down and think about, if you were in a caregiver situation, not if, when. We just talked about that quote of the 4 different type of people in the world, and they're all caregivers. When you are a caregiver, or when you are helping a caregiver, different resources that you can provide to them, and making sure that here, use Sally, she's great at doing care. Use this lawn care company, they're great, they're reliable, they're easy to work with. Just little things like that can literally take a little bit of stress off of these caregivers who are literally losing their mental stability, becoming depressed, losing their physical stability, getting chronic conditions. We've talked through both of those. Just a little financial stability. Just making sure that you're taking care of them. Even just a little suggestion might take a little weight off of that person.
Being a light in the dark for your clients is one of the most valuable things that we often experience as agents, and being able to provide that little bit of hope to someone going through a rough situation is very, very easy when you just take the time to build some of these kinds of relationships and help out these folks that, not to be selfish, but these caregivers will also be your clients someday. Mm-hmm. So looking at it as not just a resource for your current clients, but as a prospecting tool, as a way to help your community be stronger as a whole, it all just falls into place when we do the right things for people.
It's like our Zig Ziglar quote, help enough other people get where they're going, then you can have anything you want in the world. I butchered that completely, but it goes back to just
you all get the idea.
Helping enough other people And I think we titled it The Forgotten Caregiver, because unfortunately that's a lot of the times how caregivers have felt. If you can remember the caregiver, that will be a game changer for your business and for your community. So we wanted to thank you for watching this episode of The Forgotten Caregivers. Hopefully this gave you a little insight of not only how many people are caregivers, but some resources and tools that you can do to help these caregivers as an agent. And we'll catch you next time.